the introduction of this health code of red or yellow is based on our existing COVID situation. The fact that we have over 12,000 people under home quarantine, and this doesn't exist in Macau or in Shanghai, all right? We're considering this target group, and by giving them a bracelet and by giving them the red code, we hope that we will be able to enforce the home quarantine in a more effective way and try to prevent these people from causing community outbreaks. So by reducing the chance of them getting into the community, we would be able to reduce the transmission from our current level and get to a lower transmission rate of below 1. But with that, we will be able to reduce the total number and protect our healthcare system.